Hello student, Assalamu alaikum. I am Dr. Rajib Kumar Halder, Assistant Professor, Department of Anesthesiology, and very good morning. Today we are talking about the resuscitation and basic life support and advanced cardiac life support. It is very much important in our every medical life, in our practical life, and everywhere in our life. So, as I am an anesthesiologist and I am going to the details of your resuscitation program or resuscitation equipment and resuscitation process. So, it is help to your life to save the patient, and it is important to your exam is called OSPI exam. There is a station to cardiopulmonary resuscitation, so it can help on your exam and every time of your life. Resuscitation is very important, and knowledge and skill is a key for our medical science and key for safe surgery and save the patient. World Resuscitation Day or World Anesthesia Day, we can resuscitate and save life. Only two hands of every citizen can save many lives. Anesthesiologists cruciate role in resuscitation and airway management. A key part of that anesthesiologists do from pediatric to adult care. International Committee of Resuscitation, the European Resuscitation Council, and their World Resuscitation A Heart Day campaign to raise awareness about the crucial role of anesthesiologist in resuscitation. So, what is resuscitation? Resuscitation start from home to anywhere in hospital setup. So, we can start resuscitation anywhere: home, road, transport, hospital emergency, different ward, ICU and operation theatre. Highly recommended that emergency resuscitation medication must be immediately available as well as another resuscitation equipment. So, resuscitation is a part of two things: one, basic life support, and another is advanced cardiac life support. Basic life support we can provide anywhere, at home, road, transport, and special advanced cardiac life support we can only in hospital and ICU and operation theatre. So, what is resuscitation? Resuscitation is a process of connecting physiological disorders such as lack of breathing or heartbeat in an actual ill patient. It is the action or process of reviving someone from unconsciousness or apparently death or a nearly drowned person. So, student, it is the very much important to know what is resuscitation. So, I can repeat once again. Resuscitation is the process of correcting physiological disorders such as lack of breathing and heartbeat. So, this patient must have lack of breathing and heartbeat. It is an actual ill patient. It is the action or process of reviving someone from unconsciousness or apparently death or a nearly down person. So, there is two type of resuscitation mainly we are doing. One is lack of breathing. So, it is respiratory arrest, and lack of heartbeat. So, it is called cardiac arrest. So, we can start resuscitation in respiratory arrest and cardiac arrest. Resuscitation is an important part in our anesthesiologist, mostly perioperative period. Intensive care medicine is called ICU, trauma and emergency medicine. Every physician know the basic knowledge and skill of resuscitation. It is mostly important in every clinician. Resuscitation need when a patient or healthy person suddenly become collapsed or a sequence of disease process. It is not only necessary in cardiac and respiratory arrest. It is any part. There is a hypovolemic shock if the patient have hypovolemic shock, he can go to the cardiac arrest. So resuscitation must go on in hypovolemic shock. Example of early recognition of life-threatening condition, it is very much important. If you can recognize in early situation, we can do our best. So we should know the early recognition of life-threatening condition. For example, hyperperfusion is called shock, bleeding, any patient have bleeding, or electrolyte imbalance is called diarrheal disease, infective any cause is called septic shock, or cardiac cause is called cardiac arrest or cardiac shock. Gas exchange abnormality is called respiratory failure, is called hypoxemia or hypercarbia. Acid base imbalance is a metabolic cause, is called acidosis or alkalosis, is called diabetic ketoacidosis, lactic acidosis. Alter level of consciousness is called risk of aspiration. It is very much important in pediatric patient. They are highly prone to aspiration, or pregnant patient. Coagulopathy is called DIC or septicemia. So we should know it is a life-threatening condition. So we can start resuscitation as early as possible. There is a different resuscitation course in our world. For example, cardiopulmonary resuscitation is called CPR, advanced cardiac life support, advanced trauma life support, emergency prevention and resuscitation, neonatal resuscitation, pediatric advanced life support. So we mainly started with cardiopulmonary resuscitation. When resuscitation is needed, acute disease condition or condition arise during the process of treatment, natural disaster condition or man-made disaster. In all above condition, anesthesiologists around the world play a crucial role in resuscitation, and airway management is a key part of resuscitation that anesthesiologists do from pediatric to adult care. So when resuscitation is needed, we must know any natural disaster condition, earthquake, man-made disaster, acute disease condition, condition arise during the process of treatment is called cardiac arrest in operation theatre, cardiac arrest in OT, respiratory arrest in emergency department. So we should know the resuscitation and start the resuscitation. So there is some picture of showing when resuscitation start. In the road, there is a patient was lying down. You can see it is a cardiac arrest. In OT, there is a, in operation theatre, there is a going OT and the patient is cardiac arrest, then start CPR in operation theatre. In disaster, when earthquake or road traffic accident, there is a start resuscitation, and there is a multidisciplinary approach. There is a many of people who can start resuscitation and support and start the respiratory function and give the oxygen support. Outside the hospital, there is a man-made disaster or traffic accident situation, needed resuscitation from film to hospital. There is another picture. The mottos of World Register a hard day are all citizens of the world can save life. All citizens in our world can save the life. So there is a three things. Check. You should check the patient. Then call. You need support or call. Then we should call and start the compression. All that is needed to hand. All that is needed to hand. So at first we can what? We can check the patient. Is there is any cardiac arrest or respiratory arrest? Then we should call for help. Then we start the compression. So resuscitation is a teamwork but not delay based to start a single man. Resuscitation is a teamwork but we do not delay. If you know, so we should start the resuscitation. So it is a picture of resuscitation team. So resuscitation is cardiopulmonary resuscitation. We are going to details start. Check. Check is assessment, evaluate and ask, how are you? Apni kemon achen? Feel the carotid pulse. Keep the airway open. Look, listen and feel not for more than 10 seconds. Look for chest movement. Listen at mouth for breath sound. Feel for the air on your cheek. So it is important. Check, assessment, we must assessment, evaluate korte hobe, ask loudly, how are you? He is or her conscious or unconscious. Then we ask, apni kemon achen? Then feel the carotid pulse. It is important, the carotid pulse feel kora khub important. Keep the airway open. We must open the airway. Is there is obstruction? Look, there is obstruction, listen and feel, not more than 10 seconds. It is do within 10 seconds. Look for chest movement. Chest movement is important. If there is a complete obstruction, the paradoxical movement of the chest. So there is chest movement, looking is very much important. Listen at mouth or breath sound. Feel for air on your cheek. Then what we do? We can call, shout for help. ঠিক আছে? Then again after evaluation, we can do evaluation. If there is coming or not, start chest compression. The correct hand position is important. Middle of the lower half of the sternum. You can, your position, place the heel on the hand, on the other hand of the top. Compress the depth is 5 to 6 centimeter. 5 to 6 centimeter compressed start korte hobe. Then we can start our ventilation process. Effective compression and then ventilation. After 10 chest compression, give 2 ventilation. Check mouth for foreign body. Use pocket mask or ambu bag for ventilation. It is 2 ventilation. Inspiratory time is about 1 second. Give enough volume to produce visible chest rise. Avoid rapid and forceful breathe. So again, in chest compression, hand position is there in the middle of the lower half of the sternum and place the heel on the hand with other hand of the top. Heel there is a shoulder and in the hip there is a 2 side and start the chest compression and your hand is not bended, hand is straight and compression of the depth is 5 to 6 centimeter. If you 5 to 6 centimeter depth, you should need very much energy on your chest and hand and elbow is not bent, hand and elbow is straight. And again, effective compression and ventilation is very much important. After 30 chest compression, must give 2 ventilation. Then we check mouth or foreign body is present, remove the foreign body. Why every citizen must know the basic CPR? It is very much important because cardiovascular disease is the possible of 40% of all death under the age of 75 years. Rhythm, the most cases collapse with cardiac arrest. There is a 4 rhythm in cardiac arrest. There is a ventricular fibrillation, ventricular tachycardia, asystole and electromagnetic dissociation. Common and possible cause. There is a two type. One is shockable, one is non-shockable. If there is a ventricular fibrillation and ventricular tachycardia, there is shockable rhythm and we should start the DC shock. And there is asystole. Asystole, there is no rhythm, then there is no need to shock. We start the CPR as early as possible. Early recognition of cardiac arrest, it is simple and need effective resuscitation and we can save the life. If in return of spontaneous circulation after resuscitation, need an effective post resuscitation care to optimize outcome. It is a teamwork. So chain of survival is early recognition and call for help to prevent cardiac arrest, then early CPR to buy time, then early defibrillation if it is shockable and non-shockable. If it is shockable, then early defibrillation, then to start of your heart and post resuscitation care to restore the quality of your life. There is 2 type. Early CPR is basic life support. If it is early defibrillation, it is advanced cardiac life support. So, early CPR is anywhere. Basic life support is start anywhere of our world. It can be start at home, street, shop, but defibrillation, it is the advanced cardiac life support, and we should the DC machine shock. So, we need hospital care. Why early recognition? If alone start chest compression, it helps to circulate the blood to brain, heart and lung. So, if you can early recognition, then we can start chest compression, and it can help to circulate the blood to brain, heart and lung. There is a thing that there is a time for death of cardiac arrest is 5 minutes. If we can start 5 minutes, within 5 minutes, we can circulate the blood to brain and heart and lung. If there is a respiratory arrest, we can give the 8 minutes or 7 to 8 minutes to save the life. So, there is a many time, but in cardiac arrest there is only 4 minutes. Compressed, collapsed patient still has some level of oxygen in blood, because we can use 250 ml of blood per minute. So, if the patient FRC functional residual capacity is 25 ml, so we 250 ml per minute or per second we can exert our oxygen, use our oxygen, utilizes our oxygen to save the life. So, our functional residual capacity is 250 ml. So, we can 5 minutes, minimum 5 minutes to save our life. Chest compression may still supply the oxygen to vital organ for few minutes with the available oxygen in the blood. So, early initiation of CPR, we can survive 70% of patient. There is a resuscitation equipment, there is a monitor, it is a in hospital, there is a monitor, in the monitor there is a pulse oximetry, blood pressure and ECG. So, pulse oximetry, we can the oxygen saturation, blood pressure, we can see the perfusion of the body or pressure of the body, and ECG. ECG very much important in hospital, because it is the shockable or non-shockable cardiac rhythm, BTBF or asystole. Then we can start the CPR, it is asystole, and then it is a shockable, then we start the DC machine, shockable machine, DC shock machine. So, there is a two mechanisms explain the restoration of the circulating by external cardiac masses. So, what can do in CPR? There is a two type of mechanism, there is a cardiac pump and the thoracic pump. We can start the cardiac pump by blood pumping is assured by the compression of the heart between the sternum and spine. We can compress the sternum and spine, we can start the cardiac pump to supply and assure the blood supply of the body. And there is one other thoracic pump. Between the compression of the thoracic case is expanding of the heart is filled with blood. So, student, it is very much important to start the CPR. We can use the cardiac pump and thoracic pump. Cardiac pump, blood pumping, then supply to the body. Thoracic pump, between the compression of the thoracic case, the expanding of the heart to fill up the blood. And one other term is very important, that is the post resuscitation care. After resuscitation, we survive the patient, then we must the patient sent to the ICU. Intensive care unit is a multidisciplinary teamwork, and there is a multidisciplinary monitoring. After resuscitation, monitoring is very much important. There is another chance of cardiac arrest. So, strict monitoring is very much important. So, there is a post resuscitation care after return of the spontaneous circulation. start post resuscitation care, get the patient ICU and intensive care is early. So, resuscitation performance, we know the airway management, ventilation, IV access, medication preparation and administration, monitoring, post resuscitation management in ICU, and all above the action are effectively done by anesthesiologists. If a patient come in our hospital, we start resuscitation must airway management. Airway management, if the patient is breathing, not breathing and breathing, must give the oxygen, 100% oxygen, and by ambu bag or face mask or nasal cannula. If the patient is not breathing, then go to the endotracheal intubation and must secure the airway. Then ventilation. Ventilation is done by 100% oxygen, or there is a machine, anesthetic machine, or ICU, there is a ventilation machine. Then IV access. IV access is very much important. We can give the patient is vasopressors or life-saving drug. Just an example, there is adrenaline. We can give the patient is adrenaline minimum 1 to 3 ampoule and atropine and start the CPR. This drug is help to restore the heart rate and cardiac function. So, and medication, there is a IV access. We can give the patient is isotonic saline or crystalloid and colloid fluid to maintain the perfusion of the body, to maintain the nutrition of the body. Then monitoring is very much important. We must for monitoring, there is SpO2, saturation of the oxygen, then blood pressure monitoring, then temperature and urine output and consciousness level. So, and post resuscitation management is going to the ICU. Resuscitation is airway management, primary skill of anesthesiologist. We must know the airway management, and it is a key any form of resuscitation. There is a road traffic accident and the mouth or airway part is disrupted. So, what can we do? We must go to the intubation and tracheostomy. Secure the airway is very much important. If there is no oxygen, there is no life. Inability to protect and maintain patent airway will lead to oxygenation of ventilation. Oxygenation and ventilation. If we can see the noise from the airway, can identify the problem. So, we look, listen, feel. If there is a noise, so what is the noise? Snoring, mechanical obstruction. If there is a snoring, we must know it is a mechanical obstruction. Gargles, secretion, vomit and blood, hoarseness, laryngeal injury, excitation, hypoxia. If there is no oxygen supply, there is excitation and patient is hypoxic. Obtundation, carbon dioxide retention, patient is unconscious. So, snoring, if the patient is snoring, there is a mechanical obstruction in airway. And gargles, there is a secretion, vomit and blood, and clean the airway. Hoarseness, there is a laryngeal injury. Skill need to simple maneuver and tracheostomy. You must simple maneuver jaw thrust and chin up. Jaw thrust and chin up. Secure the airway is a primary goal of every anesthesiologist for the same outcome. If there is a not secure the airway, there is obstruction and give the oxygen is not supplied to the body. So, there is equipment to seal the airway. There is endotracheal tube, laryngeal mask airway, this is called LMA, and tracheostomy tube and nasal airway or oral airway. Aggressive management of airway, ventilation and oxygenation improve the patient outcome. Inherent skill of anesthesiologist, key process of oxygenation, support ventilation to artificial ventilation. So, mouth to mouth breathing or mechanical ventilation. Mouth to mouth breathing is a primary support. Mouth to mouth breathing is primary support, is primary basic life support, and in anywhere of the body, but mechanical ventilation is the advanced cardiac life support, and it is done in the hospital and ICU. IV access. IV access is an important part of medication. If there is no IV access, we can give any part of the medication, and life-saving drug we cannot give the patient. So peripheral or central line is must secure. Peripheral, then you can give the cannula, and central line is a CV line, is done in the subclavian vein or internal jugular vein, and is a IV access and go to the blood in directly to the right atrium, and is a life-saving drug, is go to the direct to the right atrium. It can circulate, and it can mechanism of action is very rapid, and it is essential for resuscitation drug to give the patient. So resuscitation medicine is an important component in any form of post resuscitation care, and appropriate drug is right time. So adrenaline is given as early as possible. Atropine is bradycardia, then give, but adrenaline we can give any time in CPR, because adrenaline is act on heart and circulating blood vessel. So if you give the adrenaline, it can improve our heart rate and give the blood pressure rises. And proper preparation, proper route of administration, mainly there is a IV route, and it is a CV line, there is a central line, so it can give. Timing of repetition, so when মানে কখন কখন আমরা দিব এটা আমাদের জানতে হবে। Anesthesiology is a special skill of preparation and administration of resuscitation or emergency drug. Resuscitation monitoring. The monitoring is an important assessing and effective of resuscitation. Anesthesiologist has best skill for identification of interruption, of taking proper action of any finding or monitoring device. Every physician must know the monitoring part and do their monitoring and very effectively. If monitoring is properly doing, the patient survival rate and the patient's outcome we can know very easily. There is a monitoring device, saturation machine device, there is a pulse oximetry, non-invasive cardiac pressure monitoring, there is a CV line, we can monitor the jugular venous pressure, urine output by the catheter, easily monitoring device in our hospital. Resuscitation ethical, yes, recording all vital event is essential for further management and medical legal purpose. Need effective teamwork is a success to any resuscitation. Effective teamwork is most important. So in the teamwork there is an anesthesiologist. So we are anesthesiologist, we must, and a good physician, we must leadership, and it is we can what? We can the command and we can follow up. So student, resuscitation is very much important in every part in our life. So we should know proper resuscitation to save our life. So there is, I am repeat, there is two type resuscitation, is basic life support and advanced cardiac life support. In anywhere, and we can do any part in our world, anywhere, home, road. So there is basic life support. In basic life support there is two type, early recognition, then call for help and start the CPR. So we can early recognition, look, listen, feel, look, listen, feel. If there is any obstruction, if there is any secretion and airway, then secure the airway and start the CPR within 5 minutes. Start the CPR, then call for help, the team was coming, then go to the hospital, then start the advanced cardiac life support. Start monitoring device, then ECG, there is a shockable and non-shockable lead, there is a shockable lead that is called VT-VF. Start the DC shock and continue your CPR, and it is a teamwork. So one man start the CPR, another physician secure the airway, or another physician start the IV access, another physician start the drug, but CPR is continue. CPR is running continue. If there is heart is coming, then go to the post resuscitation care unit, is called ICU, and continue the monitoring. is all about CPR. So, what is life saving drug? What drug we can use in CPR? There is a vasopressors. Vasopressors drug we can use CPR is called adrenaline, is one drug, and adrenaline is a drug, is a natural catecholamine and sympathomimetic drug, and it is very act on every part in our body. So, 1 to 2 to 3 ampoule adrenaline is effective in early recognition. So, is all about our cardiopulmonary resuscitation or resuscitation. Thank you.